What's up, guys? Dr. Mo here, Digital Nomad Physician at digitalnomadphysician.com. All right, let's dive right in. This is obviously what the title says. We're going to compare a few electronic health records. It's going to be atlas.md, it's going to be Acute Health, Tebra, it's going to be, what is this one? Practice Fusion. We're going to do Charm, which used to have a different name, and we're going to do Serbo, which apparently is popular, and Hint, which a lot of people ask about. So atlas.md has been around for quite a long time. They cater a little bit to the concierge medical practices and the DPC practices, sort of the monthly premium membership types. And I'm going to go over the pricing first so that everybody gets that out of the way. It's $300 a month, and as far as what they offer, I think this is probably one of the platforms that's been very consistent. They haven't really changed that much over the years, which you can say is good or bad. But for example, you can do scheduling. You can have, I don't know if they have a patient portal, but I know you can create tasks. I know that you can do like an in-basket communication with patients. And it looks like you can do some sort of messaging, at least that's what it says. So here we go. Calling, emailing, video chat, message scheduling, texting, in-app conversations, audio, transform your audio files into searchable text-based content. So that might be like a voice conversation that you turn into a soap note, I'm not sure. Health device integration and integrated eFax. So for me, when I try to think about eFax, the only time I really would need that is for like prior authorization or for anything like prescription. Certain pharmacies, if they have a down, their e-prescribing is down. So it's not very common. And again, my Digital Nomad Physician is all about private practice, cash-based practices. I don't talk about insurance. I don't want to be part of the insurance world. I just don't see a lot of benefit for us. There's apparently some artificial intelligence here now. Summarize notes, transcribe patient conversations, generate soap notes. Yeah, that's what I was guessing that they have. So that looks pretty good. Get close to companies with a company hub. Don't know what that is. Closing the gap between patient and practice. So I think this is the patient hub. This is the patient portal, which they didn't used to have back in the day, but it allows scheduling, which is really good because it's HIPAA compliant, and obviously e-prescribing. Letterheads, self-scheduling. This is the ERX, prescribe, dispense. Oh, even dispense from the office. That's pretty cool, except for those of you in, I think, New York and New Jersey or something. You can take ACH payments, so that's bank payments. I'm not sure what bank or whatever billing company that they use, like Stripe or whatever, but pretty good. I mean, this is a really thorough website, $300 a month. I'm assuming it's month to month. I doubt that you'd have to subscribe for like a year at a time. That wouldn't make a lot of sense. That's it. All right, on to Acute Health. I've done Acute Health. I was with Acute Health for quite some time. So, all right, pricing is a little complicated to figure out, but look, there's a $50 minimum and a $200 minimum, meaning based on the number of patients that you have. So if you had 100 patients, you'd kind of fall into this, in this category. But what you get is you get the e-prescribing, you get the telemedicine, so that's the video and phone call, patient scheduling, so that's the scheduling platform, intake forms, which most of us have these days, the patient portal, and then Hint and Google Calendar integration, which I use the Google Calendar integration, HIPAA compliant, email customer support, SMS and phone. Okay, so that's pretty good, but that is an optional fee. And all of the startup plus, you get lab ordering results, so I guess they connect with other labs. You get the faxing, you get data analytics, reporting, which most of us, I don't think will use, to be honest, but it's possible that you guys have that need. Secure message portal, and then this other stuff probably is less important. I mean, those of you who are looking for an API wouldn't be watching this video. Is there a minimum charge? Yes, there is. Extra charge per prescriber? I'm sure there is. Do you allow EPS? Yes, they do. That's controlled substance prescribing. Why price by active patients? What about non-member patients? What if not a membership clinic? Doesn't matter. That you can bill monthly or you can bill per patient. How does a free trial work? Can I import records from it? Yes, you can. Can I use this before clinic opens pre-enrollment? I think they let you to give you a small amount of leeway there. So you get patient intake, labs, faxing, comments and mentions, especially if you're in teams, so that's pretty good. Macro text expander, which I think for private practice, I don't see a need for that. Telemedicine, okay, great. Vitals, results expander, patient self-scheduling. The majority of the docs who follow me, the majority of the content that I create is really for the virtual clinic, for the online medical practice. So keep that in mind. Now, I'm always going to address, like, if you have a physical in-person clinic, as you saw with atlas.md, you can dispense medications out of your clinic. So that's pretty nice. That's pretty important. So I guess I'll just move on. This is Tebra. The reason I wanted to pull up Tebra, check this out. So if you go to the Tebra main page, you see here, 4.8 out of 5.0 stars. That's pretty impressive for an electronic health record. But when I pull up Tebra, can you see it on my phone? Sorry, you probably can't, but that's a 1.7, and that's 1.7 stars. And I don't know if you guys know what that is. 1.7 is the number of stars that they got. I've never seen 1.7 on an app before. That's pretty impressive. So it's far from the 4.8 that they review. 150,000 providers trust. Maybe there's 150,000 providers. There's 10,000 downloads and 30 reviews only. So imagine how many people abandoned it without even trying it. So transform your practice with Tebra all-in-one, EHR. I was going to go to pricing first. That's why I had that page pulled up, but here's the pricing. So any service, any product that I use for my private practice that doesn't have a price, to me, you're done. You're out. There's no way. I would never buy a product of which I don't know the price. Not in the US, not in our economy. So to me, it's pretty impressive that this is still done, but there's no price. I'm sure I can pull it up somewhere. I'm sure I can find it, but I guess I'm being a little bit harsh on them. That's not my intention, but I do think you need to provide prices. For me, this would be a no-go no matter what it is that they charge, because when you don't provide the price up front, you're hiding something. And I'm trying to figure out, I'm trying to catch up on what it is you're hiding. And if it's going to take me a year to figure that out, that's pretty bad. As far as products, again, I don't really understand what products you're selling. I want to know what does the EHR offer? So it says take a tour, which I don't want to do. I just want to know what you offer. Transform your practice with Tebra all-in-one. So this is how it looks apparently. This is the patient online scheduling, which is great. This is the e-prescribing and e-lab, so that's really good. I'm glad to see that. Here we go. So solutions for patients experience, designated for small independent private practice. 100% of our clients are private practitioners. Okay. EHR gives you a clear view of your template, billing practices, and I don't think can I go right? Oh, here we go. No, I can't really scroll, which is weird. Ignore my pop-ups. Here, I'll turn them off. So I can't really scroll, which is odd. Dealing with relentless admin tasks. Yes, I am relentlessly trying to figure out what your prices are and what services you offer. Legacy, Tebra's new era, all-in-one platform plus integration. Get EHR, RCM, and scheduling. Tebra is super user-friendly. Yeah, I don't know, guys. I don't see what it is that they're offering. So, again, I'm just showing you the information here. I'm not going to do all the research and then give you an idea, try to sell these guys to you, try to upsell them to you. But and it's from 2023, so the website hasn't been updated. It just doesn't look very good for this company, in my humble opinion. Here are some resources. The intake, help, product blog, pricing, and about investors. So they're looking for investors. Okay. Next, Practice Fusion. So what are your prices? $149 a month with a required annual commitment. Does not include taxes. Do you charge taxes on a service? Huh. I didn't think you do. Well, maybe you do. More features included. Get paid what you're owed with Practice Fusion billing. So they have like a billing thing. So that's kind of cool. For those of you who do insurance, fully integrated billing services. They have a dedicated billing team. That's very cool. That might be worth a lot of money if they offer billing. That's kind of a big deal. But again, if you're thinking about actually joining larger insurance companies, then you probably got to look at some of the bigger EHRs. These are to me, these are smaller, compact. They get rid of all the fluff. That's why I'm kind of comparing these. So cloud-based EHR with automation, by the way, pretty much all of them are now cloud-based. Dedicated support. This is the piece where many people, many of my colleagues, many of the physicians on my private physician group on WhatsApp have told me that, one of the first things that they were impressed by is the sales team and how much attention they paid to you in the onboarding. And then when they had any kind of issues, that's it. You never heard back from support. You couldn't get support on the line. They would always say, we got this big project that we're doing. It's going to be great for you. You'll see. And they're like, that's why we're so busy. We can't get back to you. So just saying. Personal health records, so that might be the patient portal, and labs and imaging, access to hundreds of labs and imaging centers. Again, I've said this many, many times. Labs and imaging, I can access very easily by myself. I can go to the imaging center's website, have a physician login. I can go to the lab website, have a physician login, and I can view those there. So if that's not integrated into an EHR, it's not the end of the world for me. But it's also kind of silly for it to not be integrated these days, I think. But maybe it's the APIs that they have to pay for. Simplified pricing structure, 1 provider license, 3 signing staff, unlimited non-signing staff. Schedule, upload documents, sign chart notes, sign documents, access e-prescribing and controlled substances, approve and deny ERX can be assigned to providers, MIPS, utilization, license-based access. I don't know what that all is. Why Practice Fusion, who we serve, get started, solutions, EHR with billing. So for example, I don't get a good feel about this because it's not really, this website is not written by somebody who's talked to physicians to answer their questions. Like, what does your screen look like? How quickly can I navigate it? Where can I document visits? Can I do a phone call? Can I do a telemedicine visit? Can I do a video visit? Can I send the e-prescription? Can I send a message to the patient? So none of that is here on this website. I'm sure I'd have to just click on 1,000 different buttons, and I'm just not going to. So that's this. That's Practice Fusion. The next one is, what happened? Oh, pricing. Okay, so we're on the pricing page. Again, I told you guys I'm going to start on the pricing page on all these. And we will get back to you. Please fill in the form below. Unsupported type of form. Please contact your application. Not a good sign for a software company to have their website be down on a software related issue. But you can see if I just click this like 1,000 times, it says it's like 50 cents per something and 350 per month. So let's just assume that's what it is. Services, specialties. Here are the specialties it serves. So I guess if you're urgent care, you're shit out of luck. If you're urology, you're shit out of luck. Electronic health record, practice management, patient engagement, telehealth, revenue cycle management, medical billing, services, practice onboarding, online training, EMR migration. EMR migration is important for some of you, I know that. So if you have a lot of data coming in already and you need to kind of upload it into a new chart, that's a big deal. So keep that in mind if that's really something that you need. There's a forum. Forums are never a good sign by a company because that means that they probably don't have a good support system. I could be wrong. That's been my experience with any kind of software service that I've subscribed to. So just consider that. About us, pricing, marketplace, Charm Health apps. I don't know what that means. So I don't even know what it comes with. I still don't know. I should be able to find that out. Enabling quality healthcare for all. So I don't think an EHR company can enable any kind of healthcare for all, right? If you're an EHR, be an EHR. Like, you know who's paying you. It's the doctors who are paying you the money. Don't try to get into this other piece of the game. And I say all this because I've had a lot of different electronic health records over the years, and I've done a lot of consulting for companies who need to use an EHR. So in my opinion, I think you got to know where you stand in the market. Run your clinic and enterprises efficiently, revenue cycle and billing platform. So again, this is not really something a lot of my physician clients are looking for, but if you are looking to bill insurance companies, maybe this is good, maybe this is useful. Improve performance. So again, so far, really no information about why Charm Health. Yeah, let's try family medicine. Dr. Wong, Capital Integrative Health, Family Practice Temp, online. Okay, online appointment scheduling, referral management. So I don't know what that is. Would that be a fax? Would it be digitally connecting to another EMR? Right? That's not really well described. Faster patient check-in. Don't know what that means. Fill out pre-appointment questionnaires. Okay, so they do have questionnaires. They have the e-prescribing. Does it say if it's got also controlled substance prescribing? Maybe it does. I'm reading it too fast. Patient engagement, sticky notes. Just not a lot of information, guys. So is there telemedicine? Is there not telemedicine? And it's missing a lot of information. And again, for me, a company, you're only as good as what you display to me at this moment. If it's not there on your website, again, that's your business card, right? That's the only thing I can go by. So if I get burned, I can only blame myself in the future. So this is not very, right now, empowering. So click on pricing for Cherbo or Serbo, and transparent pricing, $268 a month. That is very transparent right there. Prescriber provider, MDDO, NPND, $268 a month, $244 a month. That's a non-prescribing provider. That probably means you're getting a discount because you're not prescribing medication. So for me, like, my practice is mostly health coaching, so that makes a lot of sense. Supporting alternative providers, that's really good. And then you got clinical admin staff. So I think that's if you add somebody else, it might be an extra $16 a month, and restricted users that you bring on to like manage it for you. New practice special, they charge you a one-time setup fee of $1,200. So again, I would want to know why somebody would charge me $1,200 to rent software to me, right? Is it because they want to onboard me and train me? Is the software that difficult that I need to be trained? Do they need to set me up for something? So e-prescribing sometimes needs you to set something up, but that's often something you can do yourself. So set up your private dedicated cloud server on a custom subdomain of mdhq.com. You should be able to do that without this charge. If there is an extra charge, you should tack it onto my monthly fee. But if you think about the average physician who stays with a EHR, it's under 2 years, like 18 months, 19 months. So if you divide this by that many months, right? I mean, that's already like $50 extra a month, if I did the math right. So I don't know. I mean, I kind of want to know where that money, like that's an extra $50 a month. Maybe I should just choose a different EHR. Feature requests. Come on, like if I request a feature, doesn't mean you're going to give it to me. Security certificates. If you don't have security certificates off the bat, this is weird. This is crazy. $5.95, less than 30 patients, less than 6 months in business. Add-ons, patient portal. How many patients do you have? Okay, fair, but if you have like 2,000 patients, it's a lot of money to pay for a patient portal. And the question is, what does the patient portal offer? So you got to pay extra for telemedicine. You got to pay extra for incoming fax. And that's just incoming fax. So you can't send faxes. You got to pay a one-time fee for the styling. That's fair. That's fair, because I might be able to pay that to my own designer, but they're maybe charging that. Custom forms, $150 per hour. This is fair because incorporating forms, especially if a physician's very strict about their forms, that's not that bad, guys. Like that one, I think, does Serbo have lab integration? Yes. Do you process credit cards? Of course they do. Bluefin, Stripe. Yeah, Stripe for sure is HIPAA compliant. I'm pretty sure Bluefin is as well. I've never heard of Propeller. Can I e-prescribe? Yes, you can. You can e-prescribe standard meds, controlled substance. Really good. Can patients complete intake forms? How can I transfer financial information? Are there automated appointment reminders? Excuse me. Yes. Can I post messages? Notices for my whole patient base on the portal. Can I bill insurance? Not directly. Is there shared library of charting templates? Not currently. Can patient request appointments through the patient portal? Yes. Okay, so I mean that at least answered a lot of the main questions. Kind of surprised that they don't have like screenshots of like what the website and the app looks like, but yeah, I mean, I think that's pretty big, kind of like the user interface of these things. So maybe that's a missed opportunity. Maybe they're just, working on the product. Anyway, yeah, I don't know. I wouldn't purchase a product. I wouldn't purchase a software where I have to buy every single piece separately and then add that on, and then all of a sudden that thing is like for 12 months and that one is only for month per month, and then you have a setup fee here and a setup fee there. I don't want that. Private medical practices are so predictable and streamlined. Yes, some have very few patients, some have a lot of patients, but for the most part, they're so streamlined that just looking at how different these software companies are across the different ones, it's really crazy to me. Hint Health, pretty well known, $275 a month, pretty easy. Membership onboarding, automated billing, electronic forms, intuitive charting, e-prescribing, practice reporting, integrated email, text, phone, fax, bidirectional labs, embedded signups, integrated calendar booking, Hint Copilot, Hint Community. I mean, look, that's why I have Hint, because it's so easy. Like, look, they just like tell you exactly what you're getting. You don't have to guess at anything. And like, as soon as I clicked on pricing, it all came up. Like it was so intuitive. Includes one physician and unlimited members, plus $275 per month per extra clinician, I'm guessing. Credit cards have a 3% fee, 1% extra for Amex. ACH is 1% plus 25 cents. To me, that's not a big deal. So let's look at all the features. Plan comparison. Oh, okay. So growth. I think this one is for. Here, let me not guess. By the way, I'm in Naples, Italy. That's why all the background noise. Combined clinical with our flagship core growth platform. I think this is the practice management software thing. I think that's a good one. Again, if you're bigger and you're growing, that's a very good price. Some of the other EHR companies that offer growth, these kind of like practice management softwares, they can be an extra $500 on top. So if this is a good software, it could be really great. And then here, clinical scale. I don't know what scale your practice with advanced employee functionality. I don't know what that is. Rent Hint Connect. Whatever. Hint Copilot. Add HIPAA compliant clinical AI Copilot empowers physicians with precise documentation and communication capabilities. I don't know what that is, but sounds kind of cool. So unlimited core users, member onboarding, branded online enrollment forms, membership management, automated sign-up, follow-up notifications. By the way, the membership management is more important than you think, especially if you're going to do a monthly membership, because you want to be able to know when someone signed up before something kicks in, and when they exit your practice, and when they didn't make a payment. That's a tough system to build. Don't underestimate that. Automated sign-up, follow-up notifications, multiple sign-up pages, bulk patient uploader, digital document signing, customized standard notification, easy automated member invoices, flexible recurring billing dates, PDF invoices, share. This is pretty big if you work with employers, for example, and you're billing the employer. Sharing clinical data via patient portal, charge for labs, medications, and ancillary services, so you can have your own fee that you charge the patient, and then the patient does something, so you can kind of profit off of that thing. Practice task management, integrated clinical calendar, so that's booking. Patient self-serve portal, automated dunning and revenue to recovery, custom email notification, credit management, standard reporting, access to Hint Community and DPC Accelerator, and then inventory tracking. Inventory tracking, employer management, billing, employer enrollment, eligibility, auto-sync. So that's all the other extra stuff that's there, and you can read the rest for yourself. So that's pretty cool. And then if I click on solutions, let's see if we see some screenshots of them. Yep, there you go. That's exactly what it looks like. Honestly, that is exactly what it looks like on my screen, my own EHR. So pretty straightforward, guys. That's it. Hope this is helpful. If you have questions, check out digitalnomadphysician.com. I would love some comments down below. Ask me questions. If I know it, I will answer it for you. And if you're interested in a one-on-one session with me, go to digitalnomadphysician.com/consult. If you're interested in my online course to start your own virtual private practice, your own online medical practice, go to digitalnomadphysician.com/course. That's it, guys. Take care.